everyone. I'm Dr. David Aizuss, the chair of the American Medical Association Board of Trustees, and I'm really excited to be here today to talk with two inspiring leaders from the American Association of Physicians of Indian Origin, better known as AAPI, to talk about the challenges and opportunities facing Indian American physicians. So joining me today are Dr. Amit Chakrabarty, AAPI's new president, and Dr. Hetal Gor, who just became chair of AAPI's Board of Trustees. So there's so much ground to cover, but let's start with international medical graduates, or IMGs. Dr. Chakrabarty, can you talk a little bit about how IMGs have become such an essential part of our physician workforce and why supporting their success matters to all of us?
The physicians who are trained outside US or Canada, they make up 25% of practicing physician workforce in the United States. And out of that, 23% are from India. So this is not just a footnote, it's a foundation pillar. It's actually very vital because we fill up the role. We fill up the specialties like primary care, family medicine, internal medicine, where shortages are very acute, and we don't mind and going to rural and underserved areas where U.S. trained physicians are often reluctant to go back to or practice there. And a lot of specialties like pathology, neurology, cardiologists, they have mostly a lot of IMGs historically have been in these specialties. U.S. has always relied on IMGs to fill up these shortages in healthcare systems, in rural areas, underserved areas, and also because of them, they can improve outcomes and access.
And both of you are IMGs yourselves, so you know better than most what opportunities and challenges IMGs face. Dr. Gor, I'd love to hear your take on how these challenges have shifted from many decades ago when IMGs first began practicing in the United States.
So first of all, thank you, Dr. Aizuss and AMA for having me, from one chairperson to the other. I'm very glad that you are interviewing us. The visa has been a really, really challenging. People are matching, but they are not getting visa. And we have worked with team of people. It's not a singular stuff. We all work as a team, and we've helped so many physicians who are trained in India to get the visa.
Another problem which IMGs face is the delay in getting their green card. They've been serving in this rural community sometimes for 20, 25 years, and they're still stuck in the process. So I think this also has to be addressed. It's a very, very important issue.
At the AMA, we know how crucial it is to support IMGs. Dr. Chakrabarty, how can the AMA best support AAPI in the coming year and help address your main concerns about IMGs?
We encourage more AAPI members to join the AMA. We always have a good representation in your House of Delegates. We have had very, very strong advocacy in there. Number two, we have webinars telling them or suggesting to them what are the ways you can get into residency program, what are the little nuances, what are the things you can do to improve your chances into getting programs. We can do some joint reports with IMG contributions. We can have actually a research showing them the workforce impact, especially in underserved areas. We can actually make a scientific paper rather than just sending them just a letter stating that. This will be a real statistics, and we can do that.
So let's zoom out a bit. Indian American physicians, IMGs or not, are deeply engaged and a growing community. Dr. Gor, what are some of the top issues that you're hearing from your physician colleagues, particularly your Indian American physician colleagues right now?
So that's a very important question, not just for Indian physician, for physician in general. As you know, it's very hard to continue with independent private practices nowadays because our reimbursements are going down while the expenses are going up. The standard of living is going up. All the supply in the office has gone up, especially after tariff. To hire a good staff has been very difficult, especially after COVID. So many people have turned away from working in healthcare industries. So the pay for those staff has gone up. Along with that, the bureaucracy of charting and maintaining has gone up. we all know the problems we face from day-to-day practice. We have to get pre-authorization. Before, it used to be once in a while. Being an OBGYN, like a lot of times if somebody needed a surgery but was little younger, or it was an extensive surgery, we would need pre-authorization. Right now, we need pre-authorization for birth control pills. We need pre-authorization for day-to-day medication and investigation. So these are few of the examples which are across the board for physician.
The issues that you raised, Dr. Gore, are the identical issues that I face in my private practice, and that I think that all of us in private practice face, particularly the pre-authorization problems, hiring staff, the office overhead in the face of markedly reduced reimbursements. So I think, Dr. Chakrabarty, this brings up a good point. Why do you think it's important for Indian physicians to have strong voices in advocacy, both through AAPI and the AMA?
AMA has a lot of physicians, and we represent 100,000 physicians. If we put our heads together, efforts together, can join together to push for fair immigration reform, equitable residency access, and support at federal and state levels.
So, having said that, Dr. Gore, why should you be a member of both the AMA and AAPI? How do you answer that question when your fellow physicians ask you that question?
Strength is in number. The more number of people and physicians we have in our organization, we represent more and more issue that pertains to all of them. Secondly, when there is a strength in the number, we have more voice. So if we go to any legislator, we go to our representative, we go to Washington, D.C. to work on behalf of our physician, we can proudly say that we have X number of physicians in our organization. And if the strength in the number is there, our point can be well taken and taken seriously.
Well, I think that's great. And as you know, AAPI has been a strong and respected voice in the AMA's House of Delegates for nearly 2 decades, which is a testament to the power of collaboration between AAPI and AMA. Here's a final question I'd love you both to weigh in on. What do you see as the next chapter in our story to amplify and address the needs of Indian American physicians? Dr. Chakrabarty, let's start with you, and then Dr. Gore, you can wrap it up.
Now is the time to speak out and speak very loud. IMG equity is a national imperative. It has to be done. I have already talked about the data-driven advocacy. We need to make co-author landmark studies of Indian American physician contribution to rural health, IMG retention and burnout, diversity in medical leadership, and that will help the Washington understand the role, the importance that we have.
Dr. Gore, did you have anything you wanted to add?
Absolutely. I think being collaborative, as I said before, AMA is the largest organization, and so is AAPI is number 2. We are right behind you guys. So by having this collaboration, I want to make sure we both organization thrive. So AMA has a great legislative, background. They do legislative days in Washington, D.C. We want to collaborate with your efforts with lawmakers and see what we can do for physicians, practices as such, as we discuss about pre-authorization, reimbursement. Why can't we collaborate our efforts and be a stronger voice to DC and make sure that lawmakers follow through it? So there is so much we can improve with our experiences, with AMA's experiences, and that's what I'm looking to collaborate with AMA and achieve.
Well, I have to say, this has been an amazing conversation. It's truly fantastic. Lots of important insights from both of you. It's clear there's a lot of momentum at both of our organizations. On behalf of the AMA, I just want to say how excited we are to continue to expand our work with AAPI. And, I really appreciate both of you being here. You're both significant leaders. I want to thank everyone who will ultimately watch or listen to this recording. If you want to learn more about AMA membership, or our IMG resources, or the initiatives that Dr. Gore and Dr. Chakrabarty mentioned, there'll be links in the episode description that our audience can reference. On behalf of the American Medical Association, I want to emphasize the importance that we recognize of our IMG workforce. And so I really appreciate you both taking the opportunity to converse with me this afternoon. And I look forward to seeing you all at a future AMA meeting, and I look forward to being invited to a future AAPI meeting.